Everyone, regardless of where they live, their ethnicity, their gender, or their race, should have access to quality and affordable healthcare. But racism and bias have created structural barriers for many, resulting in health disparities and a continued erosion of trust. COVID-19 exacerbated inequities and laid bare systemic racism that leads to disparities. Whether it's unequal health outcomes, or the impact of societal inequities. People in America do not have an equal chance at achieving their best health. At all levels of healthcare, systemic racism magnifies gaps in trust. To take on and eliminate deep-rooted inequities in our healthcare system, trust must be addressed. Now, a movement has begun. Clinicians, health systems, patients, payers, advocates, and community-based organizations are exploring ways to address barriers and eliminate health disparities. This is hard, complicated, and emotional work. Trust must be at the center. That's why the ABIM Foundation and its partners are focused on equity. Together, we're building trust.